Hi, I'm Dr. Roy Hall, and I'd like to welcome you to Mountain Health Functional Medicine, my functional medicine clinic here in Billings, Montana. We opened our doors in, March 2016, and it's been a wonderful year this first year. And I just want to tell you a little bit about why we are different today. And we're part of this microcosm, or these micro practices that are being developed around the world with the idea of developing or giving you 21st century medicine. You know, I think the 20th century was famous for coming up with some great big medical clinics. Unfortunately, these have turned into kind of albatrosses. Well, we'll go over this down the road, but they're just not very functional and they're not very user friendly. And so what's happening now in the 21st century is we have these micro practices springing up around the world. And roughly there's about 30,000 in existence right now, with the goal of being 100,000 over the next 4 or 5 years. I think you're going to see a lot more clinics like us pop up because the need is here and you guys want it. But first off, I want to talk to you about why we are different, why we're different from the big clinics down by the hospitals, big clinics in your town. And one of the first reasons why we're different is because we take time to listen to you. And listening is very important to us. In the big clinics, the volumes are so big of patients coming through over and over and over that they really don't have time to sit down and to listen to you. Also, we'll go over the insurance model does not allow them to have that time. But these micro practices, Mountain Health Functional Medicine, such as we take time to listen, and we want to listen. Because we know in order to get you well, we have to hear the story of your health. We have to hear the story of your life. And we got to interpret that story in such a way that makes sense, that we can sit down and come up with a plan to get you well. And we can do that, but we can only do that if we take time to listen. And so listening is very important. The other thing that I've already alluded to that makes us a little bit different, or not a little bit different, but heck, a whole lot of difference, is we take time with you. You know, I'll say it right now. The insurance has limited the time that we can see patients. They've done this through things like Medicare. And what Medicare has done is they lower the payment to the doctors for each patient visit that you have with your doctor. So what does the doctor do? If he's getting paid less per visit, he sees more people to bump his visits number up. And so I tell people, what can you do in a 20-minute office visit? Really not a lot, because when I was working in corporate medicine and we had the 20-minute standard visits, it took me 2 minutes to review that record before I went in to see you to see if you'd been to another doctor, if you had some labs done, been to the emergency department. And at the end of the visit, it'd take me about 5 minutes to tell my nurse, we need these labs done, we need these medications ordered, and then I had to type or dictate my notes to get ready for the next person. So that'll leave us about 13 minutes to visit out of a 20-minute office visit. And you know, and I know, when I first walk in that room, or your doctor walks in the room with you, you really want to have a little chit chat with them. You want the doctor to say, well, how was your Christmas vacation? What did you do? Was Santa Claus nice to you? How are the kids? How's your better half doing? What are you doing this summertime? You got to do a little chit chat. So now we're down to a very short period of visiting. And it's very hard to get people well when you only have 5 minutes, 7 minutes. And basically what ends up happening, say you come in with problems of insomnia, we don't have time to figure out why you're having insomnia. All I have time now is to say, hey, I'm going to write you a prescription for some Ambien. Go home, take this at night, and then I'd like to see you in a month or 2 months, and let's see how it's working. And I know when you come back in 1 month, 2 months, 3 months, I'm not going to have any more time to talk with you than I do now. And so the questions are going to be at that time, after we talk about the kids and the vacations, well, how did that Ambien work? And you're going to say, great. I'm going to say, perfect. Here's your another prescription. Come back now in 6 months. Or you're going to say, you know, doc, it really didn't work very good. So I'm going to say, oh, okay. Well, here, let's try this Halcyon. Try this for a month or two. Come back and we'll visit more about it. So that's what happens when you have this limited visit of 20-minute max. We take time in functional medicine, and we take time at Mountain Health Functional Medicine we devote an hour to you. So we can sit down and we can chit chat, we can talk about vacations, and then we start talking about issues. And I tell you, if you don't need that 60 minutes, I'm not going to make you sit there and look at me. We'll disband the visit at that point. But we're going to take time to listen to you because we want to listen to you and because we know we have to listen to you. We have to get your story out, where you've come from, where you want to go, what's happening right now. The other thing that puts us different is we're insurance free. We don't follow or fall under the guidance of what the insurance people want us to do on our visits. What I mean by this is there are a lot of times you'll go to the doc and he may want to get a certain test done, either a blood test or a urine test or a saliva test or an x-ray or a CAT scan, whatever test, but is not covered by insurance. And so he doesn't get that test. We're not bound by the insurance. We don't care. We don't work with them. In fact, I tell people, really your insurance should be like your car insurance. Your health insurance should be like your car insurance. GEICO does not pay for the upkeep of your car. It does not pay to change the oil. It does not pay for the tires to be rotated or new tires. What they'll pay for is catastrophes, you getting in a wreck or getting caught on fire, something really terrible. Health insurance should be the same way. The other thing that we're not, because the insurance model doesn't apply to us, we're not a fee-for-service model. And fee-for-service is what's cropped up in the 18th century, 19th century, 20th century, and I tell you, it's very good for acute care, for emergencies, but for chronic conditions, it simply does not work. In fact, we in functional medicine say fee-for-service model is probably very unethical. And what I mean by this, well, for me as a doc to get paid by insurance to see you, I have to have you in that office. I have to have a clinic visit. That's the only way I get paid. I can't get paid if I talk to you on the telephone. I can't get paid if I send you an email or text messages. I don't get paid if you send me an email or text message. The only way I get paid is if you come in and sit down in my clinic visit. So what happens with that is we lose out on a lot of communication, me and you. We have a funny concept in this country that health is the absence of symptoms. And we know that's not true. You take that 14-year-old kid who eats fries and hamburgers every day, 3 or 4 sodas and doesn't exercise, or you take that adult man or woman who has a very stressful job working 60 hours a day, drinks 3 to 4 cups of coffee in the morning to get themselves going, 2 or 3 drinks at night to bring them down so they can rest and sleep, and they're not hurting, so you think that's health. Where I'm going with this is in the fee-for-service model, you as a patient, you have a problem, you come and see me or your doctor, doesn't matter, and you pay for that visit. Now, once you start feeling good and the symptoms are gone, you stop going because you don't want to keep paying that money. There's no need to keep paying that money because you feel okay. That's the funny idea of health. You're not all the way to a healthy state. You're just not feeling any symptoms there. So from a fee-for-service model, from the doctor's standpoint, the only way I make money is to get you in the clinic. And so I start working on that to try to get you better or to get you well. And you come in and start paying money on that clinic visit. And as soon as you feel well enough not to come in, you stop coming in. So there's a gap of where you're not completely well yet. So from a functional medicine standpoint, we say that fee-for-service model really is not ethical. From the doctor's standpoint, from your standpoint, because we never get you to that ideal state of health. So what we end up doing in Mountain Health Functional Medicine, my clinic, other functional medicine clinics, is we start having more communication with our people. We realize you don't have to come in for an office visit. We can do things over the telephone. We can do it over the computer. We can do it text messaging. I even can do it with letters. But we communicate. We hear the stories. You come into the clinic, though, we're going to spend time with you, and because we want to get you well. Our main goal in functional medicine is your health independence. We want you healthy. Traditional medicine has a tendency, again, because of the fee-for-service model, once you become a patient in that clinic, You need to come back every 3 months, 6 months, every year, over and over and over, because that's how the doc gets paid. Functional medicine, we say we want to educate you. We want to show you how to do things. We want you to understand how to do things. We want you doing things so that you don't need us. You have your health independence. So your success is our main goal. We want you well, and we want you well because we survive by referrals coming in. If we can get you well and get you independent, guess what? You're going to tell your buddy, hey, there's this clinic out on whatever street. They're going to get you well so you don't need another doctor. And then we get that person well, and they bring in their buddy, and we keep getting people well and well. We're absolutely trying to put ourselves out of business in functional medicine. We really are. I'm just looking at my notes right here. The other thing that makes us unique is our time is limited. In the old clinic situation, I could see 28 people in a day. Because if we're 1 hour visits here, we're limited to 7 patients a day. So we want to spend time with that person. We want to get them well. In fact, we really don't call people patients in this clinic, because patients are something that stay in hospitals who are sick. We see our people as healthy members or moving towards health, and we like to call our folks either clients or members of our community, and that's really the better thing, as members of our community, because the other thing that sets us apart is we're developing communities of healthy people, communities of people who are not in ideal health, but striving for ideal health, working together and moving as a herd. And that power in that community is very powerful. So let me look at my notes. Yeah, as I mentioned a while ago, we're part of this micro practices popping up around the world, and there's roughly 30,000 of us. Right now, our goal over the next 4 or 5 years is 100,000. We function as a boutique practice. It's hands-on, it's individualized care, it's personal care. So give us some good thought about coming down to visit with us. You won't be, that word won't come out, you won't be disappointed. There you go. So I tell you what, have a good day. Talk to you later.